So imagine, it's the week before your trip to Cancun, you're busy packing. You found that fantastic top that you saw all over the gram, but before you pack it, you have to get rid of the tag on the clothing. You can't find any scissors anywhere, so you do what your mom told you not to and you try to tear it off with your teeth and you chip your front tooth. Is there a worse time for that to happen? Welcome back, I'm Dr. Ryan and here to try to help you avoid stress of a chipped tooth. Chipped teeth and broken teeth in general can ruin your day. Fixing them can be costly and takes time out of your schedule. I've got a list of things you need to watch out for so that you have a better chance of avoiding a chipped tooth and by extension, avoiding your dentist. Before we dive into the details, be sure to chomp down on the like button and don't chip a tooth doing that. All right, we're gonna start with a list of things that you need to avoid to have a less of a chance of chipping a tooth. We'll start with the obvious ones. Frozen candy bars. I know I've run across many people who like to put those Snicker bars in the freezer. Don't do that. Frozen candy bars are bad news. Ice cubes. I had somebody walk in, it was a few months ago. She walked in with a cup of ice and was chewing the ice in front of me. I was about to lose my mind. Don't chew on ice cubes. Don't chew on hard candy. Also, using your teeth as tools is not a good thing to do. Don't open potato chip bags with your front teeth. Don't rip tags off of clothing. I've also had some people chip teeth trying to cut fishing line with their front teeth. Don't do any of that. Chewing on fingernails, you know not to do that. Don't do that. Also, tooth grinding. Everybody knows that if you grind your teeth, you've got a good chance of chipping a tooth. And then of course, sports. Those are all obvious things that can chip your teeth. In regards to sports, a group at the Department of Pediatric Dentistry and Orthodontics at the School of Dentistry, Federal University of Rio de Janeiro in Brazil, led by, I'm so gonna try to pronounce this correctly, Dr. Mariana Pires da Costa. Sorry if I didn't pronounce that. The group did a deep dive on the current literature we do have on sports mouth guards. They scanned all the literature in the databases for the best studies that we have. They did a systematic analysis on the information available. Citations down below. What they found was that around 85% of all oral facial injuries are traumatic dental injuries. They found that most of the research has been done about mouth guards has been for adults. Sadly, there isn't much data available on the use of mouth guards in kids. What they did note was that the younger that a kid is when they start to use sports mouth guards, the more likely they are to continue doing that throughout their sports career. Also, the thing you need to keep in mind is the greater the speed and contact involved in the sport, the greater the risk of injury. So the studies that reported high-risk injuries would include football, field hockey, ice hockey, combat sports, and rugby. I mean, like your obvious ones. Medium-risk sports were listed as basketball and soccer. All right, so prevention for this kind of stuff. So the first category, basically don't do those things. Don't eat frozen candy bars, don't chew on ice cubes. If you have to open a potato chip bag, if you have to tear a tag off of clothing, use some scissors. Great invention, works really well. And then as far as tooth grinding goes, we'll probably do a video about that at some point, but in general, use a mouth guard. And what I often tell folks to do is experiment with a mouth guard from the store first and see if you can tolerate it after using it for a couple weeks. It often takes at least 2 weeks minimum for your body to adjust sleeping with a night mouth guard in place. So you gotta give it some time. I feel really bad whenever somebody gets a mouth guard. I like for them to experiment with one from the store first rather than make them a really nice custom one and then all they do is stick in their bathroom drawer. If they're not gonna use it, I feel terrible asking them to have one made. So if you're in this situation, try one from the store first. The problem with the store-bought ones, and this is totally a topic for a different video, but I'll say it here. The problem with the store-bought ones is they are finding, I'll have to look up the paper for you, so I feel bad I'm not citing you the paper right this moment, but they are finding that the soft material that the store-bought stuff is made from seems to stimulate more chewing and grinding over the long run. So I tell folks to try one from the store first, short term. Long term, if you do well with that, we can graduate you to a custom one. So that's how that works. All right, sports, that's easy. Get a mouth guard for sports. I don't care what you use. Use something between your teeth to protect yourself from injury. Even if you're gonna go play a pickup game with some friends, a pickup game of basketball, just pop in a mouth guard. They're not too bad. You can get them from the store. Store-bought ones are way better than nothing when you're playing sports. A custom one is great, but I know they are pricey, so it's hard to afford that for as many kids as there are out there. But if you can get one from the store, that's a tremendous benefit. Definitely better than nothing. All right, we'll go on to the category of things that can chip your teeth that you may not have thought about. First one on this list is unpopped popcorn kernels. It's pretty easy if you make some popcorn at home, or if you're eating some at the movie theater, you might just grab a handful and toss it in your mouth. Try to just be conscious. Don't like just mindlessly just crunch away at everything. Just try to go slowly. Be mindful when you're eating popcorn, because the unpopped ones can be trouble. And everything in this category I'm going to get to actually, and it includes some of the things from the last category. There's rarely a situation, aside from like a car wreck or a fall or something like that, there's really a situation where just a single event is responsible for chipping or breaking your tooth. It's usually an accumulation of stress over time. I compare it to like when you get a crack in the windshield of your car. You can start with a small crack, and as time goes by, that crack gets bigger, bigger, bigger. And eventually you hit it the right way and a chunk will break off. So all the things in all these categories apply to that. And I don't want you to think that just biting on one of these things in a single event is going to necessarily cause a problem. So anyway, back to the unpopped popcorn. Watch out for the unpopped ones. They can be bad news. And if you like to intentionally eat the unpopped ones, please stop doing that. Please don't. Also, in this category, I've had people experience injuries from like candied nuts. And again, it probably wasn't the candied nut that was the sole problem. It was probably the last straw. But yeah, especially around the holiday time, like candied almonds and walnuts and stuff like that, just be mindful of those things. Definitely don't put them in the refrigerator or freezer. Also, another one in this category is metal straws. I've had, weirdly enough, like in the last year, I've had 2 patients chip front teeth on metal straws. So I would probably advise you not to use them in the car where you can't be mindful of what you're doing with them. Definitely don't walk around with a metal straw in your mouth, and definitely don't run with a metal straw in your mouth. Also, one that you may not have thought about is when you're going to pet a dog, or if you're holding a baby, a dog or a baby could pop you in the mouth and break a tooth. I have had patients experience this before. So if you're gonna go pet a dog, don't bend over directly over them, because they will jump up and pop you in the mouth. That's happened multiple times to my patients. If you're gonna pet a dog, get down on your knees and like approach them at their level, or just get down on your knees, let them come to you. Don't bend over them. And then with babies, be mindful if you have them on your lap. The young ones that are just now sitting up, they're top heavy and they're still trying to figure out how to hold that bowling ball on the top of their neck. So just be mindful that they don't put their head back and bop you in the mouth. That's happened before too, so watch out for that. Okay, now the next category is like the wait, what category? These are actually pretty common. Salad forks. I've had many patients with veneers, weirdly enough, chip veneers on salad forks, and it sounds like the most ridiculous thing. But if you think about it, salad doesn't have a lot of substance to it. So when you're eating salad, if you're eating too quickly and not paying attention, you might bite down too firmly and you'll go right through the lettuce and hit the salad fork. So be mindful of that. And then the other one really is kind of a follow-up to what we talked about earlier. I've had many patients come in over the years with a tooth that broke while they were eating bread. And they're so confused as to why bread would break their tooth. But like I said earlier, it probably wasn't the bread that did it. They probably had a crack in that tooth already, and it was just on the verge of that chunk coming off. And it just so happened that bread was the next thing that they ate, and it just went. So that's in the wait what category. All right, great. Hey, I hope that was a helpful video. If you liked it, hit the like button, chomp down on the like button. Come back next week. I'm gonna have a video here every week. So, share this with friends, anybody you think might find this interesting. And I'll see you next time. And remember, smiles are contagious.